The three countries we've been in are mainly Zambia, Botswana, and South Africa. And they have, from Botswana, which has a 1 in 3 rate estimated a couple years ago of infection, to 1 in 6 in Zambia, to 1 in 4 or 5 in South Africa. When you go there, you see a lot of young children, you see a lot of older people, but there's essentially a generation of people who are losing the economical power, the talent, the resources, and the presence due to AIDS. The only thing we really have at the moment is prevention. We can prevent this, but people who need to know don't know how. So I realize, as a virologist who knows this information and teaches it to students here at the university, and as an ordained minister in the AME Church who has grassroots contact not only in the U.S. but in Southern Africa through the bishops I know, I'm uniquely set up to get this information in a manner to the people that most need it. It seems to most people that HIV infection goes against theology, and we want to help them understand that HIV is a virus just like influenza. It's not a punishment for anything. It's a consequence of certain behaviors, and those behaviors can be changed once you understand how the virus works. Our goal is to reframe HIV as a preventable virus infection. We do that mainly through the faith leaders. The premise is that if you can get leaders in the community who are trusted, respected, have credibility, they then will move in their congregations, in their mosques, and their temples to empower other people to do the work, as well as to encourage testing, which is the first step to being in control. I actually work through the African Methodist Episcopal Church. In essence, we ask the higher authorities to invite us in to do the training in their district. We usually spend anywhere from a day to 2 to 3 days in workshops where we simply talk about the science of HIV/AIDS. We do pre and post tests to make sure that we know where the people start out in their understanding, and then we look at what happens at the end by the time we're done. And usually the test scores go up at least 15, 20, 30, 40%. We then leave them with the challenge of, now that you understand that HIV is an infectious agent, go get tested. In Zambia, where the baseline was about 15% of people that took advantage of voluntary counseling and testing, in our small pilot study group of about 90 people, in one of those returning groups, about 70% of them had been tested within the 12 months since we've been there, which is pretty incredible. We're educating people about something that for them is life-changing. We do it in a classroom setting, but it's also research, because we're asking how can we document that the model of using faith networks along with science-based information actually reaches people and makes a difference in their lives. So there are many faculty who do things right here at the university that, if put into a different setting, could make a tremendous difference in lives today. I love the research I do in the laboratory, but when you see people's lives affected, it's a whole nother level of sense of doing what you're supposed to do and using what little resources and skills you've been given to make a difference in other people's lives. I think faculty should do it if their research or their scholarly area allows, because it will make a huge difference in somebody's life and make their life much more meaningful and their scholarly work incredibly satisfying.